friend of mine in family practice down there called and said, Jerry, I've never seen this in my life. You're never going to see this again in your life, but I need to send this guy to you. He has a mass growing out of his anal verge that's at least the size of a watermelon. I mean, we sometimes say to ourselves, how does someone live with a lesion like this and not present earlier? It's just remarkable. This was a anal wart that grew into it underwent carcinomatous transformation and became a squamous cell carcinoma as big as a watermelon. And he didn't make it through surgery. But generally, obviously that doesn't commonly happen, but you need to pay attention on visualization of the anal verge for wart-like lesions because they need to be treated to prevent carcinoma. Paget's disease. Have you studied Paget's disease and Bowen's disease? So Paget's disease is cancer. It's a type of cancer, and it presents on the skin, and that means it can present on the anal verge or perianal tissue. It can look just like a patch. It's flaky and red. If you see an anal lesion like that, it needs to be biopsied. It's probably nothing, but you can't afford to miss Paget's carcinoma. And then Bowen's disease is really just what I just described, and that is squamous cell carcinoma in situ. It's a lesion. Bowen's disease is a lesion that might turn into squamous cell carcinoma. We generally see those kinds of lesions on sun-exposed skin. We call them seborrheic keratoses now, but Bowen described this in the early 20th century, so we still sometimes call it Bowen's disease. It's squamous cell carcinoma in situ. Does that make sense? So diagnosis is always a matter of biopsy, and then treatment is like any other cancer. Probably will start, commonly will start with surgery, then maybe radiation, depending upon what the lesion is. All done. All done anus, all done rectum. Questions? Okay, so again, the 4 questions on your examination will be: a patient presents with, and there'll be a series of findings, historically findings, a physical exam, and then maybe some lab. And your job is to try to figure out what that we talked about today best fits that presentation. Any other questions? There wasn't a question there, I just made one up. Okay, thank you.